Here to talk about an incredible breakthrough is cardiologist and author of the book, The Creative Destruction of Medicine, How the Digital Revolution Will Create Better Healthcare, Dr. Eric Tobel. Thanks for joining us.
Thank you, thank you.
And so, you know, there are so many advances, particularly in the world of cardiovascular medicine. Very important since it's the #1 killer of both men and women. And we recently got an email about advances in medicine. We'd love to have you help us answer. It's from Nancy in Omaha, Nebraska, and she writes, "A few people in my life have had heart attacks this past year. They were the picture of health, so it was quite surprising when it happened. Are there any tools that can predict a heart attack?" And more people seem to have stories of friends who suddenly had a heart attack, and it was so unexpected, now everyone's in fear of it.
Exactly. Well, the key is that we haven't had the way to predict them until now. We're working on something that's really exciting. The cells that come off the artery that's inflamed, that's about to crack, those cells can be detected now. And we have developed a way to not only isolate those cells, but characterize them. And so it's really a fantastic opportunity that lies ahead, that we could predict a heart attack a week or even 2 weeks ahead of when it would occur and prevent the event.
Particularly in somebody who has the risk factors for a heart attack.
Right, and one of the biggest problems, Drew, is that patients come with chest pain to the emergency room, and they don't have any evidence of damage by their blood tests or their cardiogram. They're sent home, and then they have a heart attack a day or two later. And that's the way the test can first be utilized in that setting.
So do you get these cells, how do you see them, on a blood test?
Well, yes. It turns out that these cells are remarkably more common in the blood, but they also are very sick-looking cells. They're very misshaped. And then we have a gene expression signature of the cells that's unique, that sets them apart from anything else. That can give a ringtone, the heart attack ringtone, to your phone. And so that's where we're headed with this project.
I mean, are we talking 20 years down the road, or 5 years down the road, or how long? This seems like futuristic medicine to me.
Well, it is futuristic, but it's eminently doable.
Well, this would help in the emergency department. Chest pain is one of the most difficult things in the emergency department because someone can come in with chest pain and everything looks fine, but right now we don't have tools to know if that rupture is going to occur. So this could help.
So this sensor basically would see the cells and then alert my cell phone, and then my phone would ring and it would go off, and I'd be like, "Ooh, it's for you." But you know, I know it's a little joke there, but seriously, before, it would literally alert you, "Hey, you're going to be having a heart attack in the next couple of days."
Yeah, better to get that than to be coming in with crushing chest pain.
And you actually have, again, a couple of other apps out here.
Yeah.
What other amazing technology may we be seeing soon?
Well, while we're on the heart attack thing, let me just show you. This is a way to do a cardiogram on your phone. What I can do is take this case that has a couple of sensors in the back, and I can basically convert my phone to getting a cardiogram. So I just pop this phone into the case. And what we'll show you here is, here's the screen. I'll put my thumbs on those two sensors, and in a second, you'll see my cardiogram.
Wow.
Okay? Now, hey, I got my heart rate up to 60 odd, but more important is nice sinus rhythm. Then you have this strip, and you can just send that right as you want. You can send it to your doctor. You can get automatic reading. You can send it to your Facebook friends.
Yeah, right.
Whatever you want.
And I think that these apps are truly the future of medicine. Thank you for sharing them with us.
Oh, sure.
Great stuff.